It's me, Shirley Gutkowski. I think I'm on here live, and we are waiting right now for Dr. Shalom Samuel to enter into our Zoom or into our YouTube live. Took me a minute to remember where I was. One of the things that we do here at Primal Air is that we work with children. And as a prevention specialist, because my training is in dental hygiene, I have been very interested in solving these problems that we're coming up to as adults in children. And so in order to make that happen, we have to get to the child as young as possible. And by doing that, it means that we have to sometimes see infants. Now, in a clinical dental hygiene practice, or the practice of clinical dental hygiene, here she is, the practice of clinical dental hygiene does not really include a lot of time working on pre-dentate children. So that means kids with no teeth. Hi, Dr. Shalom.
Hello.
So I was just doing a little intro here about what we do at Primal Air in my practice, and how I have a limiting factor with respect to children, specifically pre-dentate children, so kids with no teeth. Mm-hmm. And that's where the true prevention starts, right? Because we see these problems coming up in these kids that are 8 years old, they're 10 years old, they have shark teeth where one tooth comes in behind the other, or they have sinus infections and ear infections and all of that kind of stuff. So all of a sudden, I'm getting a lot of calls about babies. And so I reached out to you and I said, can you do the babies? And I'll just poke around in their mouth, and then I'll talk to the parents about what the parents can do to get the mouth in better shape. But these kids need you more than they need me, which is not to say they don't need me. So let's kind of get started with that, shall we?
Yeah, sure. From the beginning, we're taught as chiropractors that three things cause misalignments. This is just in the spine in general, but we don't delve into what it can do to the cranium. Our very first breath. So three things that cause misalignments, if anyone's hanging over that. Thoughts, traumas, and toxins. Things that we think have an effect on our spine, the things that happen to us, like birth, great thing to enter the world. But just like buying a house and getting married and having a baby, they're all great things, but yet there are stressors to our bodies. And the whole breathing mechanism actually just starts from that, being squeezed to come out, basically. And if that mechanism is not elicited, for example, like in a C-section or a complicated birth or other ways that they come out, vacuum, etc. Though that is not elicited, so you don't squeeze the cranium in the right way, and therefore the breathing is a little off. Therefore, you can see a child or a baby and see that their ears are off or the eyes are off, because multiple bones make up the cranium and the eye socket and the TMJ joint. And so they may not latch, they may not feed on both sides because they can't open their jaw on one side, because of the traumatic birth. So that time, a day, a minute after birth would be the right time to get checked. But if you don't, then as they get bigger and bigger, things don't connect, things don't talk to each other, the nerves don't talk to each other, because you have all these misalignments of the cranium. So
that what you just said was like, okay, so here it is, right? So when they can't breathe, if everything isn't lined up right after birth, and they can't breathe, usually it's because their sinuses are jacked up, right? Because their face got mushed up. So now their mouth is open.
Mm-hmm.
So even though they may not have a tongue tie, their mouth is open a lot. Sometimes we see babies with their tongues out. Mm-hmm. And so that's problematic from the dental perspective, because they're not providing enough internal pressure on the arches
to build the palate.
to build the palate, or yes, and to make it be
space
wide
for the
enough.
other teeth, right?
Right. So, and that's just one way that the tongue could be low just from having the mouth open. But with a tongue tie, it adds another dimension of problems. So that's, I was getting sent infants that have tongue ties. You were getting sent infants with tongue ties, but you didn't know it because you didn't know how to look. And so by going together, it makes it so much more accurate for our patients because we can see more and do more because it's all right here.
Yeah.
It's all structural where we are in the structures business, I guess is how you can say it. So when we have a baby, let's say 18 months or 12 months or 2 months or 2 weeks, come in for an assessment. What are you looking for? And when would you stumble across a tongue tie, for instance, let's say?
It would be in the first, in the exam, basically. Just for I think more in the last couple of months, it's just part of my repertoire to look in their mouth. It's not easy, obviously, especially wiggly babies, but it needs to be done. And from their bite, with babies, I'm just checking for the bite and if their palate is narrow, and the intermaxillary suture, if it's overlapped or not. So if it's overlapped, it could be sphenobasilar torsion, which basically base of your neck at the cranial level is kinked, basically. Or one of the cranial bones is internally or externally rotated. So each presentation shows how the cranium has misaligned, basically. So I'm checking for the palate, if it's high or not, or if the intermaxillary suture is overlapped, one or the other. And then if their bite is different. So I've seen if the sphenoid or the temporal bone or TMJ is off, then their bite is different on one side than the other. And it obviously hurt, and then they'll cry. So it's easy on one side and hard on the other. So those are the things I'm evaluating. And then I just make a note. In adults, it's different. In babies, this is how I check.
Well, and then when there is a tongue tie, are you finding that there are more things like these overlaps?
Yeah, I've seen with every single tie, there are more intermaxillary suture overlaps. And that correlates with your sagittal suture in the head. And those are all sore. Plus, I find
on top of it. Oh.
I've found that when you have a tie, one side, it pulls the one side of your body more than the other. So it's not equal. So I've seen like hypertonic or tight fibers. So if you look at the spine, if I put my hands like this, one is higher than the other. So one side, and then it switches. So our body compensates, right? So in the top, it'll be higher here, and then I'll switch, and then I'll switch again in the lower back. So they could be constipated, they could be having colic, not sleeping well. Every time you put them down, they're screaming, they arch their back, all those things.
Excellent. So, and now everybody can see why a myofunctional therapist needs to work with a craniopathically trained chiropractor. So this is why we created our package. When our patients come in for an assessment, we have a package that is for 5 and under. Those kids can't tell you really what's going on. We have to, I don't know, intuit, I guess, is more what we're looking for. They're going to be able to eat, they're going to be able to drink, they're going to be able to sleep. And the parents are like, they're sleeping,
Yeah.
They finally ate their sandwich or whatever. But we're here to identify these other little mystery things that are interfering with their good growth and development. So our charge, I think, for the two of us, and we schedule over an hour for 2 two professionals, I guess. I don't want to overstate my role, but your role is pretty fancy. And that's a long time. And we ask for photos and videos before the appointment so that we can get acclimated to what it is that we're going to be seeing in more of a controlled environment where the kid's not, what's that? What's that?
Right.
And then we do a really good assessment.
Right. And I think your role is also important. Like, it's like looking at the body as the hand as a separate thing and the eye as a separate thing and the, leg and foot as a separate thing. But that's not how it works. The brain has to tell the hand that to move. The brain has to tell the leg to move. So in this case, in the olden days, for example, I remember playing with my grandma, like blowing bubbles. Literally the exercises that you're doing, like blowing straws from this side of the table to the other, like blowing water through, or like using your mouth to play. Like, so that has been lost somehow, somewhere, somehow. So those little things, much to our surprise, we just thought it was games, but it actually helped us train our tongue, train our muscles in there. So since the era of the new things that didn't involve any of those, I feel like as a society, as a culture, we've made it all worse. And now we're going back to the basics,
There you go. Back
reiterate
to basics,
reiterating that. And on top of that, we have stressors outside, the womb as diseases and more emotional things and mental things going on around for the mom, and not enough oxygenation for the mom. And we don't think about that. And then the baby's born without not enough oxygen and has repercussions of that. So it's just not a baby born and that person getting big. It's layers and dimensions of their mom and mom's mom and things like that.
That's probably the easiest part, is to take the guilt off the parents, right? It's not your fault. It's your great grandmother's fault, who listened to the government that it was safe to eat this food or that food, or stop eating this or stop eating that. That's the easy part. It's not your fault. It's your great grandmother's fault. Is she around to protect herself? No, even better.
So it's just, we're in the field and our passions are mutual in that we want to change that for the next generation. So that in the next 6 generations, we're not getting worse, but we're getting better, and we already have enough issues around us that we shouldn't have to deal with, like fundamental things that are inborn that we somehow have lost.
Well, I think probably the best example of this whole thing is the little boy that we saw, was it a week or 3 weeks ago? And we did the whole assessment, and we did, all the things, and we're talking about this and talking about that. And near the end of the appointment, you casually said some little kids will like bang their head against the wall just to give themselves an adjustment. Yeah. And the mother was like, he does that. And you were like, all of these questions for like 49 minutes of conversation. And this one-off shows you the biggest red flag in the whole thing. Yeah. And it wasn't, I wasn't in the room. This is what you told me, but he wasn't like banging his head on the wall for a half an hour. Right. He was just like bonk on purpose.
Yeah. It's our innate, it's like God-given potential in our body, just like we get a cut and, sometimes you don't have to put anything on it. And in 2 days, it's completely healed. Well, how did that happen? It's that same principle,
Exactly.
So certain things we crave, like, we talk about craving certain foods equals deficiency in certain minerals and vitamins. That same way that our body, and especially babies, they're not biased on anything. Will this work? Will it not work? They just accept how it is. So they need sleep, they'll sleep. They need to hit their heads against the wall to adjust something in their neck. They're going to do that.
They're going to try it. Hey, that worked. Let's do it again.
So it's the innate in us that brings it out.
Well, and it'd be much better if you were doing it for him in a nice, mild little way.
Right.
You're very good at doing those on the move adjustments. I mean, the kid was like all over the place, and you're like, whatever
Yeah.
you do there with your thumbs and all that.
Mhm.
So, and it's not when you're doing with children, I know, while we're talking here, people are like, oh, I can't believe they're going to crack a baby. That's not how it is, and
Yeah.
especially with the assessment. The
Right.
assessment is very mild, just a little bit of pressure here and there. You do go in the baby's mouth with gloves on and you feel around in there. You look at their eyebrows. Are they squishing down? Or because they're not going to say anything. They're
Mhm.
pre-verbal.
Yeah.
And so there's not a lot to say, but you can get a lot out of what their reaction is to whatever it is that you're doing.
Yeah. Yeah, for sure.
Well, and the playing piece is now on my health history is, what does your baby do? Well, they're only old enough for mouth games like raspberries or something like that, because it has been lost because we've been separated from our ancestors.
Mhm.
um, you're you immigrated with your parents, right? So
Mhm.
you're new, and your girls are first generation then, which is what I am.
Mhm.
And my mother cooked German foods. You probably cook Indian foods,
Mhm.
but we didn't do anything that they did in the old country.
Mhm.
She was forced to cook German foods because my dad liked it, right?
Mhm.
She wanted to be an American more than anything else in the world. And that's where everything was going to go. And
Mhm.
so Americans don't do this, they don't do that, they don't do the other thing. Well, of course, we're a melting pot. And if each culture isn't loud about their cultural things, or there might be a little embarrassing, it doesn't transfer through,
Right.
so it gets dropped off. Now
Mhm.
when your girls move away to Texas or wherever they're going to land up, you're even more separated. um, the dentist that we work with, I think she does a little bit more of the traditional Indian stuff than
Mhm.
maybe what you did. Did you do all that binding and everything after you had your babies?
No, they didn't do it for me, but they did it for my mom when I was born.
Mm-hmm. Yeah. And they still do it in India. Is that right? Or
Uh-huh,
no?
yeah.
Yeah.
But they all want the westernized things. Oh, that who does that?
There you
The
go. The
mapping and
American
whatnot.
thing.
Yeah.
And now we
Uh,
know we should be embarrassed.
so yeah, then like we as babies we used to get massages, so I'm told, and like tapping of the head slowly with oil, which is all like cranial stuff. Yeah, and like my grandma used to pitch the nose so the nose doesn't get flat, but that's like releasing your sinuses and stuff like that. So we
Traditional
lost all
stuff
of that.
that they learned how to do before cars.
Right.
All
Yeah.
right. Well, this was great. I think people get to know us a little bit better now. And I don't see infants by myself. I see infants with you. And we get really good results when we work together. We get better results when we
Right.
work together and tight together. We're in the same building, even though you're in your room over there and
Yeah.
I'm over here. But we're in close proximity as well. And
Hmm.
we're working right now. We're near Madison, Wisconsin, and we're working on potentially having a location in the Milwaukee area.
Hmm.
So it might be another year or so out, but it's on paper. We're getting there.
Yeah. Yeah.
So thank you so much for everything, and thank you for being flexible and to learn and to teach. And let's solve some more problems.
Yeah, for sure. Thank you.